Hello, my name is Claudia Constand, and this is my poster presentation about my doctoral experience, which focused on the use of mind-body interventions to improve emotion regulation in at-risk youth. So the rationale behind this capstone project relates to the well-studied relationship between developmental trauma and a host of negative outcomes, like chronic disease, mental illness, poverty, addiction, and low academic achievement. In addition, the relationship between developmental trauma and emotion regulation deficits is well established. Impaired emotion regulation has been associated with deficits in psychological health, social functioning, and academic performance. It is also well established that at-risk youth experience these traumas and negative outcomes at a disproportionate rate. The link between mindfulness, which is an essential feature of mind-body interventions, and healthy emotion regulation capacities is well documented. All of that background knowledge led to the creation of this capstone project, which had the primary objective to assess the state of the evidence evaluating the effectiveness of mind-body interventions on emotion regulation in at-risk youth, first through a systematic review, and to then examine its applications through a site-specific case study. So the systematic review was guided by the PRISMA process and resulted in 17 articles that met eligibility criteria. Methodological quality was assessed using Science critical appraisal tools, and internal validity and bias were assessed using Cochrane's risk of bias table. And finally, the quality of evidence and strength of recommendation was evaluated using the Journal of Clinical Epidemiology's grade guidelines. So interventions were categorized into 4 groups: mindfulness interventions, mind-body skills groups, yoga, and transcendental meditation. And outcomes related to emotion regulation were categorized into 5 groups: anxiety, PTSD, depression, perceived stress, and self-regulation. So based on the results of the grade process, mind-body interventions are recommended to improve emotion regulation outcomes in at-risk youth. This is a weak recommendation based on moderate quality evidence. However, mindfulness interventions received the highest quality rating between moderate and high, and therefore received the strongest recommendation of all mind-body interventions. And this is why I propose the implementation of a mindfulness-based program for my case report. So for my doctoral experience, I was placed at Buckeye Ranch's Bonner Academy at Cross Creek, which is a day treatment program that integrates education with mental health services for middle and high school students whose psychological or behavioral needs have been unable to be met in a traditional school setting. Most students at Cross Creek have histories of developmental trauma and present with impaired emotion regulation capacities. My primary role at this site was to incorporate the occupational therapy perspective into the operations of the setting by providing consultation services. These services largely addressed alternative treatment strategies for addressing emotion regulation deficits, including mindfulness-based and sensory-based intervention strategies. So during my experience, I worked alongside a fellow doctoral student to design 2 sensory modulation spaces and create guidelines for the appropriate use of each space. I implemented a mindfulness-based protocol and assessed outcomes in a small group of students, and I provided staff training on the implementation of the program. I also facilitated daily group therapy sessions alongside clinicians and group specialists. So the primary objective of my capstone project was to assess the effects of a school-based mindfulness intervention on outcomes related to emotion regulation in adolescents with histories of psychological trauma. My study involved 3 students, ages 15 to 16, with documented mental illness and adverse childhood experiences. For the intervention, I followed the guidelines of a mindfulness program called Learning to Breathe, which is a mindfulness-based stress reduction program adapted for middle and high school students. The intervention included 6 weekly sessions of 45 minutes each, with each session guided by one of 6 core themes, which corresponded with the acronym BREATHE, with the last letter representing the overall goal of the program. Each session included an opening mindful breathing practice, group discussions and activities related to the week's theme, formal mindfulness practice, and encouragement of home practices. The study design followed a pre-post treatment schedule to assess outcomes related to emotion regulation, including social connectedness, depression, self-compassion, and perceived stress. Participant 2 was absent the day of post-treatment assessment collection, and due to the unexpected closing of the school, her scores were unable to be obtained. Of the scores that were available for the other 2 participants, 5 of 8 post-treatment assessment scores improved in comparison to pre-treatment assessment scores. So based on the results of the systematic review and the case report, the implementation of the mindfulness-based intervention, specifically Learning to Breathe protocol, is recommended for this population. So one question someone might have is, what is mindfulness? Do I have to meditate to practice mindfulness? Mindfulness is the awareness that arises from paying purposeful, non-judgmental attention to the present moment. It's more of a state of being rather than a technique. So meditation is a practice that strengthens the state of mindfulness, but you can also practice mindfulness in your everyday life by simply becoming purposefully aware of whatever it is you're engaged in. Another question might be, why is mindfulness important? Beyond improved emotion regulation, research has associated mindfulness with many benefits like improved working memory, decreased anxiety and depression, improved self-compassion, improved pain management, reduced stress, and improved quality of life. And another question might be, how does mindfulness relate to occupational therapy? As a holistic medical profession, a core tenet of occupational therapy practice that distinguishes it from other healthcare professions is the emphasis on valuing the whole person and understanding the synergistic relationship between the body and the mind. A fundamental goal of occupational therapy practice is to improve our clients' quality of life. And so, given that the relationship between mindfulness and quality of life is well documented, mindfulness-based interventions are well suited for all occupational therapy settings. So thank you for listening. If you have any questions, please feel free to email me at constan.1@osu.edu.